बेस्ड रिसर्च। सिर्फ खुराक काफ़ी नहीं। जदीद तहकीक बताती है कि खून में मौजूद कोलेस्ट्रॉल का तकरीबन 75% हिस्सा जिगर खुद बनाता है और सिर्फ 25% खुराक से आता है। इसलिए मौरूसी जिनियाती अवामिल भी कोलेस्ट्रॉल बढ़ाने में अहम किरदार अदा करते हैं। अंडे और झींगे, एग्स एंड श्रिम्प, पुरानी तहकीक कोलेस्ट्रॉल एक मोमी वैक्सीन मादा है जो आपके जिगर में कुदरती तौर पर बनता है और जिसम के हर खुलिये सेल के मुनासिब कामकाज हार्मोन जैसे एस्ट्रोजन और टेस्टोस्टेरोन और विटामिन डी की तैयारी इंतहाई जरूरी है। ताकि खून में इसकी ज्यादा दौरे और फालिज का बायस बन सकती है। जदीद तिब्बी तहकीक की रोशनी में कोलेस्ट्रॉल की मुकम्मल तफसील ये है। कोलेस्ट्रॉल की अक़साम। कोलेस्ट्रॉल खून में प्रोटीन के साथ मिलकर सफर करता है जिन्हें लिपोप्रोटीन्स कहा जाता है। एलडीएल लो डेंसिटी लिपोप्रोटीन खराब कोलेस्ट्रॉल। इसे खराब इसलिए कहा जाता है क्योंकि ये शरीयानों की दीवारों को जम जाता है जिससे खून की नालियां तंग और सख्त हो जाती हैं। इस हालत को एथेरोस्क्लेरोसिस कहते हैं। एचडीएल हाई डेंसिटी लिपोप्रोटीन अच्छा कोलेस्ट्रॉल। इसे अच्छा कोलेस्ट्रॉल इसलिए माना जाता है क्योंकि ये इजाफी कोलेस्ट्रॉल को खून की नालियों से निकालकर वापस जिगर तक पहुंचाता है जहां से ये जिस्म से खारिज हो जाता है। ट्राइग्लिसराइड्स ये खून में पाई जाने वाली एक और किस्म की चर्बी फैट है जो खाई जाने वाली इजाफी कैलोरी से बनती है। इसकी ज्यादा मिकदार भी दिल के अमराज का खतरा बढ़ाती है। कोलेस्ट्रॉल की मिसाली सतह। जदीद तिब्बी माहिरीन के मुताबिक खून में कोलेस्ट्रॉल की सतह मिलीग्राम पर डेसीलिटर यानी mg पर dl होनी चाहिए। एलडीएल खराब कोलेस्ट्रॉल 100 mg पर dl से कम बेहतरीन। एचडीएल अच्छा कोलेस्ट्रॉल मर्दों के लिए 40 mg पर dl या इससे ज्यादा और खवातीन के लिए 50 mg पर dl या इससे ज्यादा। कोलेस्ट्रॉल 200 mg पर dl से कम। ट्राइग्लिसराइड्स 150 mg पर dl से कम। ब्लड प्रेशर खून का दबाव खून की नालियों की दीवारों पर खून के दबाव की पैमाइश है। जदीद तिब्बी तहकीक के मुताबिक नॉर्मल ब्लड प्रेशर 120/80 मिलीमीटर पारा mmHg से कम होना चाहिए। जदीद तरीन गाइडलाइंस और तहकीक की रोशनी में ब्लड प्रेशर की अक़साम, वजूहात, अलामत और इलाज की तफसील ये है। ब्लड प्रेशर की दरबंदी। तिब्बी तहकीक के मुताबिक ब्लड प्रेशर की 4 बुनियादी अक़साम हैं। नॉर्मल 120/80 mmHg से कम। एलिवेटेड ऊपर वाला प्रेशर 120 से 129 mmHg के दरमियान और नीचे वाला 80 mmHg से कम। स्टेज 1 हाइपरटेंशन। स्टेज 1 ऊपर वाला 130 से 139 mmHg या नीचे वाला 80 से 89 mmHg। स्टेज 2 हाइपरटेंशन। स्टेज 2 ऊपर वाला 140 mmHg या इससे ज्यादा या नीचे वाला 90 mmHg या इससे ज्यादा। हाइपरटेंशन क्राइसिस। हाइपरटेंसिव क्राइसिस ऊपर वाला 180 mmHg से ज्यादा और नीचे वाला 120 mmHg से ज्यादा। ये हंगामी तिब्बी सूरत हाल है। खामोश कातिल। नई तिब्बी रिपोर्ट्स के मुताबिक ज्यादा ब्लड प्रेशर को खामोश कातिल कहा जाता है क्योंकि अक्सर मरीजों में इसकी कोई वाज़ेह अलामत ज़ाहिर नहीं होती लेकिन ये अंदर ही अंदर दिल, दिमाग और गुर्दों को शदीद नुकसान पहुंचा सकता है। बुनियादी वजूहात और रिस्क फैक्टर्स। जदीद तहकीक के मुताबिक ब्लड प्रेशर बढ़ने के अहम असबाब ये हैं। जिनियाती अवामिल, जेनेटिक्स, खानदानी तारीख, ग़िज़ा, नमक सोडियम का ज्यादा इस्तेमाल, प्रोसेस्ड फूड और चिकनाई वाली ग़िज़ाएं, तर्ज ज़िंदगी, वर्जिश की कमी, मोटापा, तंबाकू नोशी और अल्कोहल का इस्तेमाल, तनाव, स्ट्रेस, मुस्तकिल ज़हनी दबाव और नींद की कमी, उम्र और दीगर बीमारियां, उम्र बढ़ने के साथ रिश्तों का सख्त होना, ज़्यादतीज़ और गुर्दों के अमराज़। मुमकिन अलामत अगरचे खामोशी से बढ़ता है लेकिन शदीद सूरत में ये अलामत ज़ाहिर हो सकती हैं। सर में शदीद दर्द, खुसुस सुबह के वक्त, सादा पड़ना, सीने में दर्द या बेचैनी, नज़र का धुंधलापन, थकान और उलझन। जदीद साइंसी इलाज और लाइफस्टाइल। जदीद तिब्बी तहकीक जैसे अमेरिकन हार्ट एसोसिएशन की गाइडलाइंस के मुताबिक ब्लड प्रेशर को कंट्रोल करने के लिए तर्ज ज़िंदगी में सबसे बुनियादी इलाज है। 1 ग़िज़ाई तब्दीलियां, डाइटरी चेंजेस, डाइट, फल, सब्जियां, कम चिकनाई वाली मसनूआत और सारा अनाज, होल ग्रेन्स इस्तेमाल करें। नमक की मात्रा को 100 से 100 मिलीग्राम तक महदूद करें। 2 वर्जिश और वज़न कमी। रोजाना कम से कम 30 मिनट की वर्जिश जैसे तेज कदमी या स्किपिंग और वज़न को मुतवाज़िन रखना खून की शरीयानों को लचकदार बनाता है। 3 अद्वियात, मेडिकेशन। अगर लाइफस्टाइल से ब्लड प्रेशर कंट्रोल ना हो तो डॉक्टर अद्वियात तजवीज़ करते हैं। एसी इनहिबिटर्स, एआरडीज, एंजियोटेंसिन रिसेप्टर ब्लॉकर्स, कैल्शियम चैनल ब्लॉकर्स, डाययूरेटिक्स। क्या आप अपने किसी अज़ीज़ के ब्लड प्रेशर के हवाले से मज़ीद जानकारी हासिल करना चाहते हैं? अगर आप मुझे मौजूदा लिंक बताएं तो मैं आपको मज़ीद मखसूस और तफसीली मशवरा फराहम कर सकती हूँ। यूरिक एसिड जिसमें कुदरती तौर पर बनने वाला एक कीमियाई मादा है जो प्यूरिन नामी प्रोटीन के टूटने से पैदा होता है। ताकि साइंसी तकनीक के मुताबिक इसकी ज्यादती दोनों में दर्द, गाउट और गुर्दे की पथरी का बाइस बन सकती है। इसकी मुकम्मल तफसील, अलामत और जदीद तिब्बी इलाज। यूरिक एसिड क्यों बढ़ता है? जब जिसम यूरिन बैठने को जाता है आम हालात में खून के जरिए पहुंचे और पेशाब के रास्ते खाली हो जाता है। हम ब्लड सेल विभाजन बनना इसका खर्च कम होता है या पैदावार बढ़ जाती है। ग़िज़ा ऐसी खुराक का ज्यादा इस्तेमाल जिनमें प्यूरिन ज्यादा जैसे सुर्ख, समृद्ध ग़िज़ा और नीम मशरूबात। जिनियाती अवामिल, खानदानी तारीख के बाइस यूरिक एसिड की सतह बदल सकती है। मोटापा और मेटाबॉलिक सिंड्रोम, वज़न का ज्यादा होना गुर्दों की यूरिक एसिड खारिज करने की सलाहियत को बाधित करता है। दीगर तिब्बी मसाइल, हाई प्रेशर, ज़्यादती या गुर्दों के फालिज में आम अलामत। खून यूरिक एसिड का बढ़ जाना एक खामोश बीमारी है लेकिन जब ये दोनों मोस्ट यूरिक एसिड शक्ल में जमा होना शुरू हो जाए तो ये अलामत ज़ाहिर होती है। जोड़ों में शदीद दर्द, खासतौर पर टाँगों में जो सूजन, गर्म महसूस होना और सुस्त हो जाना। जोड़ों की हरकत और तकलीफ, शरीर को जोड़ों के नीचे गिल्टियां, उठना जाना। नॉर्मल सतह, साइंस में जदीद तिब्बी वर्ल्ड के मुताबिक खून में यूरिक एसिड नॉर्मल सतह ही है। मर्दों में 40 से 40 मिलीग्राम डेसीलीटर, औरतों में 2 से 7 से 3 मिलीग्राम डेसीलीटर। जदीद तहकीक की रोशनी में बचाव और खुराक। मौजूदा साइंसी तहकीक के मुताबिक तर्ज ज़िंदगी में यूरिक को कंट्रोल करने में 85% इदारा करती है। ये खाएं विटामिन सी का पूरक, ताज़ी सब्जियां, कम चिकनाई वाली तीखी मसनूआत और कॉफी। साइंसी तहकीक के मुताबिक कॉफी यूरिक एसिड बढ़ने में मदद है। क्या ना खाएं? रेड मीट, बीफ, मटन, दलीची, शराब, हाई फ्रक्टोज मिठास, लबन, मशरूबात से परहेज़ करें। हाइड्रेशन दिन भर में कम से कम 5 से 10 पानी पिएं ताकि गुर्दे से आसानी खर्च कर सकें। इलाज अगर तर्ज ज़िंदगी और तब्दीली से यूरिक एसिड कंट्रोल ना हो जदीद तिब्बी दर्द इलाज का इस्तेमाल किया जा रहा है। एलोपैथी और फिजियोथेरेपी जिसमें यूरिक एसिड करती हैं। प्रोटीन से ये गुर्दों में यूरिक एसिड ज्यादा खर्च करने में मदद देती हैं। दर्द और सूजन को फौरन कंट्रोल करने के लिए डॉक्टर से या दर्द को करते हैं। अगर आपको कोई तकलीफ से शिकायत है तो मैं आपकी मदद कर सकता हूं। अगर आप बताएं कि आपने हाल ही में यूरिक एसिड टेस्ट करवाया है और उसकी सलाह है कि आपको जोड़ों में दर्द, सूजन जैसी कोई अलामत महसूस हुई है, क्या आपको इसके अलावा कोई और बीमारी ज़्यादती से ब्लड प्रेशर है जिसकी बुनियाद पर आपको मज़ीद तफसील और बेहतर गाइडलाइन फराहम की जा सके। कमेंट सेक्शन में तफसील के साथ लिखें। ज़ियादतीस एक दायमी मेटाबॉलिक बीमारी है जिसमें खून में शुगर, ग्लूकोज की सतह मामूल से ज्यादा हो जाती है। जदीद साइंसी तहकीक के मुताबिक इसकी बुनियादी वजह लबलबे पैंक्रियास का मुनासिब मिकदार में इंसुलिन पैदा न करना या जिस्म का इंसुलिन का मौसर तरीके से इस्तेमाल न करना, इंसुलिन रेजिस्टेंस है। हालिया तहकीक की रोशनी में ज़ियादतीस की मुकम्मल गाइड ब्लड सेल है। ज़ियादतीस की अक़साम। टाइप 1 ज़ियादतीस, टाइप 1 डायबिटीज ये एक ऑटो इम्यून बीमारी है। इसमें जिस्म का मुदाफ़िती निज़ाम लबलबे के इंसुलिन बनाने वाले खलियात को तबाह कर देता है। इसके शिकार अफराद को रोजाना इंसुलिन के इंजेक्शन की ज़रूरत होती है। टाइप 2 ज़ियादतीस, टाइप 2 डायबिटीज ये सबसे आम किस्म है जिसमें जिस्म इंसुलिन का सही इस्तेमाल नहीं कर पाता। ये तर्ज ज़िंदगी, मोटापे और मौरूसी अवामिल की बाइस होती है। जेस्टेशनल ज़ियादतीस, जेस्टेशनल डायबिटीज ये हमले के दौरान ख़वातीन में नमदार होती है और ज़्यादातर बच्चे की पैदाइश के बाद खुद ब खुद खत्म हो जाती है। आम अलामत अगर आपको दर्द से अलामत मुस्तकिल महसूस हो तो फौरन डॉक्टर से रुजू करें। बहुत ज़्यादा प्यास लगना और बार-बार पेशाब आना, बला वजह वज़न में तेज़ी से कमी वाक़ई होना, हर वक्त शदीद थकन और कमज़ोरी का एहसास होना, धुंधला दिखाई देना, ज़ख्मों पर बहुत देर से भरना, बार-बार इन्फेक्शन, खुसूसन जल्द या पेशाब का होना। जदीद साइंसी तहकीक और इलाज। जदीद मेडिकल साइंस में ज़ियादतीस के इलाज और इंतज़ाम में इनकलाबी तब्दीलियां मुतारिफ कराई हैं। इनजाम है मुसलसल ग्लूकोज मॉनिटरिंग (सीजीएम). अब ऐसे छोटे सेंसर दस्तयाब हैं जो जिस्म पर लग जाते हैं और 24 घंटे खून में शुगर की सतह स्मार्टफोन पर दिखाते रहते हैं। स्मार्ट इंसुलिन पंप्स। जदीद इंसुलिन पंप्स खून में शुगर की निवेश को खुद महसूस करके दुरुस्त मिकदार में इंसुलिन जिस्म में खारिज करते हैं। नई अद्वियात तहकीक ने ऐसी अद्वियात मुतारिफ कराई हैं जो न सिर्फ शुगर को कंट्रोल करती हैं बल्कि गुर्दों और दिल की हिफाजत भी करती हैं। स्टेम सेल थेरेपी। टाइप 1 ज़ियादतीस के इलाज के लिए स्टेम सेल पर तहकीक जारी है ताकि लबलबे की खराब खुराक को दोबारा फाल किया जा सके। लाइफस्टाइल और खुराक। तब्दीली माहिरीन के मुताबिक तर्ज ज़िंदगी में तब्दीली से टाइप 2 ज़ियादतीस को कंट्रोल और रिवर्स किया जा सकता है। मुतवाज़िन ग़िज़ा अपनी खुराक में फाइबर, सब्जियां, फल और साबित अनाज की मकदार बढ़ाएं और प्रोसेस्ड शुगर, सफ़ेद रोटी और मीठी मशरूबात से मुकम्मल परहेज़ करें। वर्जिश रोजाना कम से कम 30 मिनट की तेज़ कदमी या वर्जिश को मामूल बनाएं। ये जिस्म में इंसुलिन की हसासियत को बेहतर बनाती है। वज़न में कमी। जिस्मानी वज़न का 5 से 7% से कम करने से तबीयत को कंट्रोल करने में ज़बरदस्त मदद मिलती है। ज़ियादतीस की पेचीदगियां। शुगर लेवल तवील अरसे तक हाई रहने से जिस्म के अहम मसाइल को नुकसान पहुंच सकता है। इसमें शामिल है दिल की दौरे और फालिज का खतरा, आसानी निज़ाम की खराबी, न्यूरोपैथी, गुर्दों के अमराज, नेफ्रोपैथी, बीमारी का मुतासिर होना, रेटिनोपैथी। नोट: ज़ियादतीस एक खामोश कातिल बीमारी है। इसकी तशख़ीस और इलाज के लिए हमेशा किसी मुस्तकिल कैमोलॉजिस्ट से मशवरा करें।
इंसानी जिस्म की बेहतरीन कारकर्दगी के लिए विटामिन और मिनरल्स बुनियादी जुज़ हैं। ये दो सामग्री होते हैं, पानी में हल होने वाले और चर्बी में हल होने वाले। जदीद साइंसी तहकीक की रोशनी में इनकी तफसील दर्ज है। एक, पानी में हल होने वाले विटामिन, ये जिस्म में ज़ख़ीरा नहीं होते, इसलिए इन्हें रोज़ाना खुराक से हासिल करना ज़रूरी है। विटामिन सी मुदाफ़िती निज़ाम को मजबूत करता है और जल्द के लिए कोलेजन बनाता है। हासिल करें तुशफल, माल्टा, लीमू, स्ट्रॉबेरी और शिमला मिर्च। बी कॉम्प्लेक्स, ये 8 विटामिन का मजमूआ है, जैसे B1, B6, B12, जो तवानाई पैदा करने और आसानी निज़ाम को दुरुस्त रखने में मददगार है। हासिल करें अंडे, दूध, सब्ज़ पत्तों वाली सब्जियां और गोश्त। 2, चर्बी में हल होने वाले विटामिन, ये विटामिन जिस्म की चर्बी में जज्ब होते हैं और जिगर में ज़ख़ीरा होते हैं। विटामिन डी हड्डियों की मजबूती और कैल्शियम जज्ब करने के लिए नागज़ीर है। हासिल करें रोज़ाना सुबह की धूप, फैटी फिश, सामन और फोर्टिफाइड दूध। विटामिन ए आंखों की बीमारी और हड्डियों की नशोनुमा के लिए ज़रूरी है। हासिल करें गाजर, शकरकंदी और पालक। विटामिन ई ये ताकतवर एंटीऑक्सीडेंट है जो खलियों को नुकसान से बचाता है। हासिल करें बादाम, सूरजमुखी के बीज और जैतून का तेल। विटामिन के खून को जमने से रोकने, ज़ख्म पर और हड्डियों की सेहत के लिए अहम है। हासिल करें ब्रोकली और बंद गोभी। 3, अहम मिनरल्स मादनियात जिस्म को सेहतमंद रखने के लिए इनकी भी बहुत ज़रूरत होती है। कैल्शियम हड्डियों और दांतों की मजबूती का अमीन। हासिल करें दूध, दही और पनीर। आयरन खून में ऑक्सीजन की फराहमी हीमोग्लोबिन के लिए लाज़मी है। हासिल करें पालक, दालें और सुर्ख गोश्त। जिंक मुदाफ़िती निज़ाम को बेहतर बनाता है और ज़ख्म भरने में मदद करता है। हासिल करें कद्दू के बीज, गोश्त और नट्स। मैग्नीशियम पट्टों की सुगड़ने और ब्लड प्रेशर को कंट्रोल करने में मुआविन है। हासिल करें डार्क चॉकलेट, बादाम और एवोकाडो। मुस्तकिल मालूमात अपनी रोज़ाना की खुराक की चार्ट के लिए आलमी इदारे सेहत WHO की वेबसाइट विजिट करें। अगर आप चाहें तो मैं आपकी रहनुमाई के लिए दर्ज मालूमात फराहम कर सकता हूं। क्या आप किसी मखसूस बीमारी जैसे खून की कमी या हड्डियों के कमजोर होने के हवाले से मालूमात चाहते हैं? क्या आप अपनी उम्र और जिन्स बताना पसंद करेंगे ताकि आपकी ज़ाती ज़रूरियात के मुताबिक ग़िज़ाई मशवरा दे सकूं?
तवील अरसा तंदुरुस्त और सेहतमंद जिंदगी पाने का नुस्खा कीमिया जदीद साइंसी तहकीक की रोशनी में। तवील और सेहतमंद जिंदगी का राज जदीद साइंसी तहकीक की रोशनी में मुतवाज़िन खुराक, बाकायदा जिस्मानी वर्जिश, म्यारी नींद और ज़हनी तनाव को कम करने में पोशीदा है। साइंसी माहिर के मुताबिक रोज़मर्रा की अच्छी आदत से न सिर्फ उम्र बढ़ती है बल्कि बुढ़ापे में भी बीमारियां दूर रहती हैं। सेहतमंद और तवील जिंदगी के लिए दर्ज झेल बातों पर अमल करना निहायत ज़रूरी है। मुतवाज़िन ग़िज़ा, मुतवाज़िन डाइट। अपनी खुराक में ताज़ा सब्जियां, फल, सारा अनाज, होल ग्रेन्स और प्रोटीन शामिल करें। चीनी, बाज़ारी खानों और चिकनाई का इस्तेमाल कम से कम करें। जिस्मानी सरगर्मी, एक्सरसाइज। रोज़ाना कम से कम 30 मिनट की वर्जिश जैसे चहलकदमी, जॉगिंग या स्विमिंग को मामूल बनाएं। ये दिल की बीमारियों और ज़्यादती के खतरे को कम करती है। म्यारी नींद, गहरी नींद। रोज़ाना 7 से 8 घंटे की सुकून नींद लें। अच्छी नींद जिस्मानी खुलियात की मरम्मत करती है और दिमागी सेहत को बेहतर बनाती है। ज़हनी दबाव से दूरी, ज़हनी तनाव में कमी। योगा, मुराक़बा, मेडिटेशन और गहरे सांस लेने की मशकों से ज़हनी दबाव को कंट्रोल करें। तंबाकू से परहेज़, सिगरेट नोशी करने से फेफड़ों के कैंसर और दिल के दौरे के खतरा नुमाया तौर पर कम हो जाते हैं। बाकायदा तबीबी मुआयने, स्क्रीनिंग, किसी भी बीमारी के वक्त इलाज के लिए अपने डॉक्टर से बाकायदा चेकअप कराते रहें।
A window air conditioner running for 5 minutes and then stopping for 15 minutes is likely experiencing short cycling, often caused by a dirty air filter, restricted airflow, or faulty thermostat sensor. The unit is likely overloading and shutting down to prevent damage, failing to properly dehumidify or cool the room. Common reasons for this behavior: dirty filter airflow blockage. A clogged filter restricts airflow, causing the evaporator coils to freeze or the unit to overheat, forcing it to shut down. Dirty condenser coils. If the exterior coils are dirty, the unit cannot release heat efficiently, causing it to overheat and turn off. Misaligned thermostat sensor. The sensor may be positioned too close to the cold coils, causing it to read the air as colder than it is and shut the unit off prematurely. Oversized unit. If the AC is too powerful for the room, it cools the immediate area instantly and turns off before cooling the entire room. Low refrigerant. A refrigerant leak can cause the system to freeze up and stop cooling, resulting in short cycles. What to do? Clean or replace the air filter immediately. Clean the outdoor condenser coils to allow proper heat release. Ensure the thermostat sensor is positioned correctly, not touching the coils. If the issue persists, the compressor may be overheating, requiring professional service.
Human body respiratory system. 4. Neural control and regulation. Breathing is primarily automated by the but can be voluntarily influenced. Medulla oblongata establishes the rhythmic pace of breathing using the dorsal respiratory root, inspiration, and ventral respiratory root, forced breathing. Pons modulates the breathing rate via the pneumotaxic center, prevents overinflation, and apneutic center, prolongs inspiration. Chemoreceptors detect changes in CO2, O2, and pH. High CO2 levels lower pH, triggering faster, deeper breathing to expel the acid-causing waste. 5. AI-driven advancements in respiratory science. AI and machine learning (ML) are transforming respiratory care through advanced automated diagnostics. MDPI. Smart inhalers utilize sensors to monitor usage type, track adherence, and provide data to optimize treatment for asthma and COPD. Auscultation and digital stethoscopes. AI algorithms can analyze lung sounds to detect crackles and wheezes with high precision, approximately 85 to 90% accuracy, overcoming the subjectivity of traditional stethoscopes. Diagnostic imaging. Deep learning models (DL models) can quickly interpret chest CT scans and X-rays to identify nodules and lung diseases, including tuberculosis. Ventilation optimization. AI systems such as VentAI can optimize mechanical ventilation settings, positive and expiratory pressure, at volume in real time, reducing mortality and complications in ICU patients. Predictive analytics. ML models can forecast respiratory exacerbations like COPD days before they occur by analyzing sensor data. Organ on a chip. Microfluidic technologies are used to mimic lung function, providing a way to study disease mechanisms and test drugs at a cellular level. 6. Common respiratory disorders. Chronic obstructive pulmonary disease (COPD), long-term obstruction of airflow, pneumonia, infection of the alveoli causing fluid buildup, pneumothorax, air enters the cavity causing lung collapse, apnea, cessation of breathing commonly during sleep. 7. Other functions. Beyond breathing, the system allows for vocalization, speech via vocal cord vibration in the larynx, and facilitates the sense of smell via the olfactory nerve.
A comprehensive and scientifically backed overview of food sources for essential vitamins and minerals is organized below based on nutritional research. Upon diet, focusing on whole foods, fruits, vegetables, lean proteins, nuts, seeds, and whole grains is the best way to obtain these micronutrients. Fat-soluble vitamins stored in the body. Vitamin A, retinol, and beta-carotene. Beef liver, eggs, fish, fortified milk, sweet potatoes, carrots, pumpkin, spinach, cantaloupe. Vitamin D, fortified milk or yogurt, fatty fish, salmon, sardines, egg yolks, fortified breakfast cereals, cod oil. Vitamin E, vegetable oils, safflower, sunflower, nuts, almonds, hazelnuts, seeds, sunflower, leafy green vegetables, spinach, broccoli. Vitamin K, kale, spinach, broccoli, collard greens, cabbage, soybean oil, canola oil. Water-soluble vitamins need regular intake. Vitamin C, citrus fruits, oranges, grapefruit, red and green peppers, kiwi, strawberries, broccoli, tomatoes. Vitamin B1, whole grains, pork, liver, legumes, beans, lentils, enriched cereals. Vitamin B2, milk, cheese, eggs, liver, enriched fats and cereals. Vitamin B3, meat, poultry, fish, whole grains, nuts, legumes. Vitamin B5, almost all in one foods, especially chicken, beef, potatoes, oats. Vitamin B6, fish, beef liver, bananas, chickpeas, potatoes, chicken. Vitamin B7, eggs, salmon, pork, sunflower seeds, sweet potatoes. Vitamin B9, folate, folic acid, dark green leafy vegetables, spinach, asparagus, oranges, legumes, beans, lentils, fortified cereals. Vitamin B12, meat, fish, poultry, eggs, milk, fortified cereals, natural acids and fats, major minerals, required larger amounts, calcium, milk and dairy products, sardines, kale, broccoli, fortified plant-based milk and nutries, magnesium, spinach, nuts, almonds, legumes, seeds, brown rice, whole bread, potassium, bananas, potatoes, white beans, salmon, yogurt, leafy greens, fresh juice, sodium, table salt, sodium chloride, soy sauce, processed foods, phosphorus, red meat, dairy products, fish, chicken, whole grains, pea minerals, required small amounts, iron, red meat, poultry, beans, iron, fortified cereals, dry fruit, veg, zinc, oysters, red meat, poultry, shellfish, veggies, nuts, iodine, high salt, seaweed, dairy products, salmon, nuts, seafood, proteins, eggs, pepper, chocolate, nuts, seeds, sulfur, mayonnaise, nuts, legumes, whole grains, tea, meat, whole grains, fiber, fluoride, fluoride, water, tea, fish, nutrients, foods, dark green leafy vegetables, spinach, kale, broccoli, vitamin K, egg, seed, folate, iron, calcium, vitamin B, extremely high vitamin A, B2, iron, nuts, seeds, almonds, nuts, sunflower seeds, vitamin E, magnesium, fish, salmon, mackerel, sardines, vitamin D, calcium, beans, lentils, chickpeas, iron, magnesium, folate.
Based on scientific research and advancements,
May 2026, the endocrine system is recognized as a complex and dynamic regulatory network, increasingly managed through AI-driven precision medicine and novel hormonal therapies. It operates by releasing signaling molecules, hormones, directly into the bloodstream to coordinate bodily functions, metabolism, growth, and reproduction by locking into specific target cells. Core components and glandular functions. The system comprises major glands that act as centers of homeostasis, often utilizing feedback loops to maintain balance. Hypothalamus, the master integrator linking nervous and endocrine system, regulating the pituitary gland via neural hormones. Pituitary gland, known as the master gland, it produces hormones that regulate other endocrine glands, including growth hormone, DH, ACTH, and TSH. Thyroid gland produces triiodothyronine and venlafaxine, trypsin, and metabolism. 2026 research emphasizes that both iodine deficiency and excess can cause dysfunction. Adrenal glands, divided into the medulla, epinephrine, norepinephrine for fight or flight, and cortex, cortisol for stress and metabolism, and aldosterone for sodium balance. Pancreas produces insulin, lowers blood sugar, and glucagon raises blood sugar. Gonads, ovaries, testes produce sex steroids, estrogen, progesterone, testosterone, regulating reproductive health. Pineal gland releases melatonin to regulate circadian rhythms. Nature 2026 scientific advancements and research. Research in 2026 focuses on overcoming metabolic disorders and optimizing hormone delivery. GLP-1 receptor agonist, GLP-1 RAs, continued dominance research with studies expanding to show their effectiveness in reducing and managing type 1 diabetes, in addition to cardiovascular, adipose, and kidney benefits. Orforglipron, Foundayo, approved as the first daily oral non-peptide GLP-1 pill, which does not require strict food or water restrictions. Type 1 diabetes, T1D, breakthroughs, advancements in generating insulin-producing cells from human stem cells show promise for curing T1D. The drug pill is available to expand children 1 year and older to delay onset of T1D. For personalized medical advice, always consult a qualified health professional.
Endocrine system, part 2. Adipin protein research. Research highlights that adipin can improve reproductive function and insulin sensitivity in diabetic cases, performing better than metformin and restoring testicular health in studies. Bone/pain management. A bone-related hormone has been identified that can stop pain-sensing nerves from growing into damaged spinal areas, offering new avenues for chronic back pain treatment. Oral insulin. Researchers at Kumamoto University are advancing oral insulin pill technology, which could replace daily injections for millions. Reproductive and endocrine links. Studies on GABA and kisspeptin show they play significant roles in regulating metabolic and reproductive homeostasis. AI and endocrinology, 2026 landscape. Artificial intelligence is deeply integrated into diagnosis and patient monitoring, often exceeding 99% accuracy in specific validation sets for cancer classification. Predictive diagnostics. AI algorithms are used to screen thyroid nodules, detect adrenal malignancies, and assess osteoporosis risks. Personalized treatment. Machine learning models are used for personalized diabetes care, including glycemic control prediction and closed-loop insulin delivery, artificial pancreas. Virtual care. AI enhances telemedicine by allowing remote monitoring of pathologies and risk factors. Menopause and brain health. New research connects menopause to brain marrow loss in brain regions involved in memory and emotional regulation. Endocrine disruptors. Growing evidence links excessive prenatal thyroid dysfunction to increased autism risk in children. Obesity and metabolism. Evidence suggests that skipping breakfast and eating late dinners increases the risk of osteoporosis and metabolic issues. Future outlook 2026 plus. The focus is shifting towards precision, durable, disease-modifying therapies, moving beyond mere symptom management. Key research agendas include developing better, faster-acting insulin, refining long-term metabolic management through GLP-1 agonists, and understanding the genetic factors that affect hormone drug efficacy. For personalized medical advice, always consult a qualified healthcare professional.
Human body respiratory system. 4. Neural control and regulation. Breathing is primarily automated by the brainstem, but can be voluntarily influenced. Medulla oblongata establishes the rhythmic pace of breathing using the dorsal respiratory group, inspiration, and ventral respiratory group, forced breathing. Pons modulates the breathing rate via the pneumotaxic center, prevents overinflation, and apneustic center, prolongs inspiration. Chemoreceptors detect changes in CO2, O2, and pH. High CO2 levels lower pH, triggering faster, deeper breathing to expel the acid causing waste. 5. AI-driven advancements in respiratory science. AI and machine learning (ML) are transforming respiratory care through advanced automated diagnostics. MDPI. Smart inhalers utilize sensors to monitor usage technique, track adherence, and provide data to optimize treatment for asthma and COPD. Auscultation and digital stethoscopes. AI algorithms can analyze lung sounds to detect crackles and wheezes with high precision, approximately 85 to 90% accuracy, overcoming the subjectivity of traditional stethoscopes. Diagnostic imaging. Deep learning models (DL models) can quickly interpret chest CT scans and X-rays to identify nodules and lung diseases, including tuberculosis. Ventilation optimization. AI systems such as VentAI can optimize mechanical ventilation settings, positive and expiratory pressure, tidal volume in real time, reducing mortality and complications in ICU patients. Predictive analytics. ML models can forecast respiratory exacerbations like COPD days before they occur by analyzing sensor data. Organ on chip. Microfluidic technologies are used to mimic lung function, providing a way to study disease mechanisms and test drugs at a cellular level. Sex. Common respiratory disorders. Chronic obstructive pulmonary disease (COPD), long-term obstruction of airflow, pneumonia, infection of the alveoli causing fluid buildup, pneumothorax, air enters the cavity causing lung collapse, apnea, cessation of breathing, commonly during sleep. 7. Other functions. Beyond breathing, the system allows for vocalization, speech, via vocal cord vibration in the larynx, and facilitates the cell via the olfactory nerve. Human respiratory
System. Description. Heartbeats. Function. The human respiratory system is a complex, high-efficiency biological apparatus responsible for gas exchange, supplying oxygen (O2) to blood, and removing carbon dioxide (CO2) waste. It operates through the interplay of anatomical structures, mechanical forces, and neural control to maintain internal homeostasis. 1. Functional anatomy and structure. The system is divided into the upper and lower respiratory tracts, designed for conducting, warming, filtering, and humidifying air. Upper respiratory tract includes the nose/nasal cavity, primary air entry point, filtered by cilia and mucus, mouth, alternative air passage, and pharynx, throat. Lower respiratory tract comprises the larynx, voice box, containing the epiglottis to prevent food aspiration, trachea, windpipe, bronchi, and lungs. The tracheobronchial tree. The trachea branches into left and right primary bronchi, which divide into secondary and tertiary bronchi, eventually branching into smaller bronchioles, forming a tree-like structure. Alveoli. The terminal end of the bronchioles. These tiny grape-like air sacs, approximately 150 million per lung, are the functional units of respiration where gas exchange occurs. Thoracic cavity. Lungs are housed in the rib cage, separated by the medius sinum, which is the heart. The entire thoracic cavity is enclosed by the pleurae, thin membranes that allow the lungs to move smoothly during breathing. 2. Physiology of respiration. Breathing. The respiratory system acts as a gas exchange mechanism operating via tidal breathing. Inhalation, inspiration, active process. The diaphragm, main muscle, contracts and moves downward, while intercostal muscles tighten, expanding the chest cavity and decreasing pressure, sucking air into lungs. Exhalation, expiration, passive process, rest. The diaphragm relaxes and moves back up, shrinking the chest cavity and forcing air out, powered by the natural elasticity of the lungs. Pulmonary gas exchange. External respiration occurs at the alveoli by passive diffusion. Oxygen moves from alveoli into pulmonary capillaries, and CO2 moves from blood alveoli. Tissue gas exchange. Internal respiration. Oxygen moves from capillaries into cells, and CO2 moves from cells into capillaries. 3. Key physiological mechanisms. Mucociliary escalator. The larynx, trachea, and bronchi are lined with ciliated epithelial cells and mucus, trapping dust and bacteria and moving out to the pharynx to be swallowed. Alveolar surfactant. Type 2 cells in the alveoli secrete surfactant, reducing surface tension to prevent alveolar collapse during exhalation. CO2 and pH regulation. The system acts as a buffer to maintain blood acidity by regulating CO2 removal, ensuring the body does not become too acidic. 3. Cardiac cycle and electrical system. The cardiac cycle consists of alternating contraction, systole, and dilation, diastole. Electrical conduction system. The heart generates its own impulses, automaticity, via specialized cells. Sinoatrial node, the primary pacemaker in the right atrium that initiates the heartbeat. Atrioventricular node, delays the electrical signal to allow atria to finish emptying blood into ventricles. Middle His and Purkinje fibers rapidly transmit impulses, causing ventricles to contract from the apex upward. Cardiac cyclesis. Diastole, ventricles relax and fill with blood. Systole, ventricles contract, raising pressure to eject blood into the pulmonary artery and aorta. 4. Regulation and homeostasis. Blood pressure regulation, controlled by autonomic nerve signals. Sympathetic increases heart rate, parasympathetic decreases it, and hormones. Hemostasis, platelets and fiber form clots to seal damaged vessels. Temperature regulation, blood vessels dilate, vasodilation, to release heat near the skin surface, or constrict, vasoconstriction, to retain core heat. 5. Advanced AI in cardiovascular medicine. AI is transforming cardiology from reactive to predictive care. Diagnostics. AI algorithms analyze electrocardiograms, ECGs, and imaging, MRI, CT, with high accuracy, detecting conditions like arrhythmia and cardiomyopathies faster than traditional methods. Risk prediction. Machine learning models predict major adverse cardiovascular events, MACE, by analyzing vast datasets. Imaging segmentation. AI automates the quantification of myocardial strain and ventricular volume in echocardiography.
The cardiovascular circulatory system is a closed high-pressure network composed of the heart, blood vessels, and blood, functioning to transport oxygen, nutrients, hormones, and waste products throughout the body. It is central to maintaining homeostasis, regulating body temperature, and providing immune protection. 1. Anatomy of the cardiovascular system. The system is divided into two primary loops, pulmonary and systemic circulation, powered by a full-chambered muscular pump. The heart, muscular pump. Located in the thoracic cavity behind the sternum, the heart consists of 3 layers: the outer epicardium, the thick muscular middle myocardium, and the inner endocardium. Chambers: 2 superior atria, collecting chambers, and 2 inferior ventricles, pumping chambers. Septum: a muscular wall separating the left and right sides to prevent mixing of oxygenated and deoxygenated blood. Valves: 4 valves: tricuspid, pulmonary, mitral, aortic, ensure one-way flow. Blood vessels, the highway. Arteries, thick, elastic vessels that carry high-pressure blood away from the heart, exception pulmonary artery. Arterioles, smaller arteries that regulate blood flow and pressure into capillaries through vasoconstriction, vasodilation. Capillaries, microscopic, single-cell thick vessels where gas and nutrient exchange occurs. Veins, lower-pressure vessels with pulmonary valves that return blood to the heart. Blood, transport medium, approximately 5 liters of fluid consisting of plasma, red blood cells, transporting O2, white blood cells, immune defense, and platelets, clotting. 2. Physiology and circulation pathways. The heart acts as a double pump that functions in 2 main loops simultaneously. Pulmonary circuit, right side, low pressure. Deoxygenated blood returns from the body via superior inferior vena cava, right atrium, right ventricle, pulmonary artery, lungs, picks up O2, releases CO2. Systemic circuit, left side, high pressure. Oxygenated blood returns lungs, pulmonary veins, left atrium, left ventricle, surrounding chamber, aorta, body tissues, coronary circulation, dedicated vessels, coronary arteries that supply the myocardium with oxygen, branching directly from the aorta.
Multivitamins, or MVMs, are formulated to provide a spectrum of essential vitamins and minerals, acting as nutritional insurance to fill dietary gaps. While they are not a replacement for a balanced diet, scientific research in 2025-2026 suggests potential benefits for specific populations, including cognitive support, slow biological aging in older adults, and addressing deficiencies in pregnant women and those with restricted diets. Key scientific findings and benefits 2025-2026 update. Recent AI-based analysis and large-scale studies have refined the understanding of multivitamin efficacy. Slowing biological aging. A 2026 study published in Nature Medicine found that daily multivitamin usage among adults over 60 can modestly slow epigenetic clocks, effectively reducing biological aging by roughly 4 months over 2 years. Cognitive function preservation. Evidence from the Cosmos Mind trial indicates that daily MVM use improved global cognition, memory, and executive function in older adults, ages 60 plus, with benefits equivalent to reducing cognitive aging by approximately 2 years. Nutritional insurance and deficiency prevention. MVMs effectively increase intake of critical micronutrients like vitamin D, B12, and magnesium in individuals with poor diets. Pregnancy outcomes. MVMs containing folic acid and iron are crucial for preventing neural tube defects and lowering the risk of low birth weight and preterm births. Immune system support. Zinc, vitamin C, and vitamin D and MVMs play a key role in maintaining robust immune function, particularly in elderly populations. Limitations and nuances in research. Mortality and chronic disease. A massive 2024 analysis of 400,000 US adults found that daily multivitamin use did not reduce the risk of death from heart disease, cancer, or other causes. No superpower effect. Research consistently shows that MVMs do not prevent chronic diseases in well-nourished healthy populations. Safety hazards for smokers. High doses of beta-carotene and vitamin A in some MVMs have been linked to an increased risk of lung cancer in smokers and those exposed to asbestos. Key populations who benefit most. Scientific literature suggests targeting rather than broad supplementation. Older adults 50 plus benefits from B12, calcium, and vitamin D due to reduced absorption efficiency. Pregnant or breastfeeding women requires folic acid, iron, and iodine. Individuals with restricted diets. Vegans, vegetarians, or those on low-calorie diets often lack iron, B12, and zinc. People with malabsorption syndromes, including those with celiac disease or gastric bypass surgery. Recommendations for safe use. Check the label. Look for products that provide nutrients close to 100% of the daily value (DV) rather than extremely high doses, as excess vitamins like vitamin A, iron, and zinc can be harmful. Third-party testing. Choose brands verified by independent organizations such as NSF International or USP to ensure quality and purity. Drug interactions. Consult a doctor, particularly if taking anticoagulants, blood thinners like Coumadin or Tiazepam, as high vitamin K can interfere with medication. Disclaimer: this information is for educational purposes only and does not constitute medical advice. Consult a healthcare provider before starting any new supplement regimen. As of May 2026, scientific research regarding multivitamin, multimineral, and MVM supplements shows a shift from general one-size-fits-all recommendations towards targeted, personalized supplementation, with AI playing a crucial role in predicting efficacy, optimizing bioavailability, and analyzing health outcomes. While major studies have often found minimal benefits of MVMs in reducing all-cause mortality, cardiovascular disease, or cancer, recent evidence highlights specific advantages in cognitive health, slow biological aging, and nutritional adequacy in specific populations. Key scientific findings 2025-2026. Slowing biological aging. Data from the Cosmos clinical trial published in 2026 indicates that daily multivitamin use can slow biological aging, with participants seeing a reduction of approximately 4 months of aging over 2 years. Cognitive benefits. Research consistently suggests that daily MVM use may improve global cognition, memory, and slow cognitive aging in older adults. Pregnancy and birth outcomes. MVM supplementation in pregnant women, particularly in low-income settings, is linked to reduced risk of low birth weight and preterm births. Minimal effect on mortality. Most RCTs have found no significant benefit of general MVMs on all-cause mortality, visual acuity, or COVID-19 outcomes. AI integration and R&D. AI is currently used to analyze the efficacy of complex compounds, terpenes, peptides, fungi, and optimize the nutrient-dense supplements. AI-guided supplement recommendations have been shown to reduce LDL cholesterol by 25.3%, outperforming standard methods. Detailed multivitamin and mineral breakdown. 1. Essential vitamins. Vitamin D. Crucial plasma absorption and immune health. High-dose supplements can be beneficial in individual populations, but the vital studies suggest low benefits for the general population. B vitamins. Essential for energy yield and metabolism and mental fatigue reduction. B6, B9, folate, and B12 are crucial for brain and muscular function. Vitamin A and beta-carotene, important for vision and immune health. However, studies show that smokers should avoid beta-carotene supplements. Vitamin C, known for antioxidant properties and protecting the body against oxidative stress. 2. Essential minerals, macrominerals, and trace elements. Magnesium, essential for muscle and nerve function, often included in multivitamin supplements for overall health. Zinc, vital for wound healing and immune function, especially when combined with antioxidants. Iron, necessary for oxygen transport, is particularly recommended for women with childbearing potential. Calcium, critical for bone strength, often combined with vitamin D to reduce fracture risk in postmenopausal women. Selenium, plays a key role in antioxidant and enzyme systems and may have potential in cancer prevention. Chromium picolinate, used for metabolic support and managing sugar balance. Key considerations for supplementation. Bioavailability, the effectiveness of minerals depends heavily on its compound form, a key focus of current AI-optimized formulations. As intakes, high-dose long-term use of certain supplements can lead to risks, particularly if nutrient levels already meet requirements from food. Targeted use. Supplements are most beneficial for specific groups, such as those with limited dietary intake, pregnant women, or older adults. AI and future directions. 2026-2031. Personalized nutrition. AI is advancing personalized nutrition through digital assessment apps that track and analyze daily dietary patterns to inform better, more targeted nutrient recommendations. Industry trends. The global MVM market is projected to grow to $20.73 billion in 2026, driven by rising preventive health and personalized dietary products.
The human nervous system is a highly specialized, complex communication network that regulates all physiological and cellular processes, such as the input, integrating this information, and initiating motor output to maintain homeostasis, enable consciousness, and interact with the environment. Structurally, it divided into the central nervous system, CNS, and peripheral nervous system, PNS. Structural organization. Central nervous system, CNS, the command center comprising the brain and spinal cord, housed within the skull and the vertebral column. Peripheral nervous system, PNS, a network of nerves, 12 pairs of brain nerves, 31 pairs of spinal nerves, and ganglia outside the CNS that connects the CNS to limbs, organs, and skin. 2. Cellular components. Nervous tissue consists of 2 main cell types. Neurons, functional units that receive, process, and transmit information via electrical and chemical signals. Structure, composed of soma, cell body, dendrites receive signals, and axon carries signals away. Types, sensory neurons, ganglia, motor neurons, gastric commands, interneurons process information within the CNS, neuroglia, glial cells, supporting cells that maintain homeostasis, form myelin, and provide support and protection for neurons. Astrocytes, CNS, regulate blood flow and maintain the blood-brain barrier. Oligodendrocytes, CNS, small cells, PNS, produce myelin, and insulated sheath that increases signal speed. Microglia, CNS, act as immune effectors, 3. Neurophysiology, how it works. Neurons communicate through electrical signaling, alternating electrical signals within the neuron, and control signals between neurons. Resting memory potential. A non-activated neuron has a negative neural charge, approximately -70 millivolts, maintained by atoms. Action potential. An electrical impulse generated when a neuron is stimulated past the threshold, approximately -55 millivolts. Sodium channels open causing depolarization. Anxiety causes positive. Self-determinate action. In myelinated neurons, the signal jumps between GABA and myelin causes regular, rapidly increasing speed. Synapse and neurotransmitters. The jumping neuron communicates with another cell. An action potential possibilities of chemical receptors and receptors in the synaptic cleft. These receptors are the same cell, exciting one innate. 4. Functional classifications. Somatic nervous system, SNS, controls voluntary movements of skeletal muscles, processes sensory input from the skin, muscles, and joints. Autonomic nervous system, ANS, controls involuntary physical functions, heart rate, digestion, glandular secretion. Sympathetic digestion initiates fight or flight responses, eating, increased heart rate. Parasympathetic digestion manages breath and digestive states, e.g. slow heart rate, stimulating digestion. And parasympathetic system, ES, complex body neurons and the walls of the digestive tract, control digestion independently. 5. Protective mechanisms. Because nervous tissue fragile, is protected by bone structure, cell and column, lineages, pre-protected membranes, neuromatic, brachiomotor, pia matter, cerebrospinal fluid, CSF, cushions of the brain and spinal cord, blood-brain barrier, highly selective magnetic responses to the brain. 6. Common pathologies. Neurodegenerative disorders, Parkinson's disease, Alzheimer's disease, multiple sclerosis, vascular accidents, stroke, infections, meningitis, functional muscular disorders, epilepsy, injuries, genetic brain injuries, spinal injuries.
To look after your liver, AI and medical experts recommend maintaining a healthy weight, exercising regularly to reduce liver fat, eliminate alcohol. Key dietary changes include reducing sugar and saturated fats while increasing fiber, green tea, and vegetables. AI tools are increasingly used for early detection of liver fibrosis and managing transplant care. Key lifestyle and dietary recommendations. Diet. Focus on whole foods, including vegetables, fruits, nuts, and healthy fats like olive oil. High fat foods like oatmeal can help reduce inflammation. Weight and activity. Maintain a healthy weight and exercise regularly to burn triglycerides and reduce fat buildup in the liver. Alcohol and toxins. Minimize alcohol intake and limit exposure to environmental toxins, either insecticides or aerosols. Sleep. Prioritize consistent sleep to ensure the liver can process toxins and manage insulin effectively. How AI and technology support liver health. Diagnostic imaging and pathology. AI algorithms analyze CT, MRI, and digitized pathology slides to identify liver disease markers, fibrosis, tumors more precisely. Non-invasive screening tools. AI-driven tools such as LiverFast or LiverPro analyze routine blood tests to assess liver fibrosis and inflammation without biopsies. Predictive analytics. AI can analyze patient data to predict disease progression and optimize transplant waiting lists. Disclaimer: AI tools are meant to support medical professionals and do not replace professional medical advice, diagnosis, or treatment. The human body is an exceptionally organized entity consisting of 11 major organ systems that collaborate to maintain homeostasis, internal balance. These systems, ranging from the framework of the skeleton to the control of the nervous system, work together to ensure survival, respiration, nutrient absorption, and waste removal. Here is a comprehensive breakdown of the internal body systems and their functions. 1. Nervous system, control and coordination. The control hub of the body, managing voluntary and involuntary actions. Components: brain, spinal cord, nerves, sensory organs. Function: detects environmental changes, processes information, and sends electrical signals to coordinate body activities. Key action: interprets sensations, sight, sound, touch, and directs immediate responses such as reflexes. 2. Cardiovascular, circulatory system. Transport: the body's transportation network, keeping cells alive through circulation. Components: heart, blood vessels, arteries, veins, capillaries, and blood. Function: pumps oxygenated blood and nutrients to tissues and transports waste products like carbon dioxide away. Key action: regulates body temperature and pH balance. 3. Respiratory system, gas exchange. The system responsible for taking in oxygen and expelling waste gas. Components: lungs, trachea, bronchi, larynx, diaphragm. Function: facilitates gas exchange between the environment and the body, supplying and removing. Key action: maintains blood pH balance by controlling carbon dioxide levels. 5. Digestive system, nutrient absorption. Processes food into energy and absorbs nutrients into the bloodstream. Components: mouth, esophagus, stomach, liver, gallbladder, pancreas, small intestine, large intestine. Function: breaks down food mechanically and chemically into nutrients, absorbing them for growth and energy, and eliminates solid waste. 6. Musculoskeletal system, movement and structure. Often split into skeletal and muscular systems. This provides stability and locomotion. Components: bones, muscles, cartilage, tendons, ligaments. Function: provides structure and protection for internal organs, allows movement, produces blood cells and stores minerals. 7. Endocrine system, hormone regulation. Controls long-term body processes through chemical messengers, hormones. Components: glands, pituitary, thyroid, adrenal, pancreas, ovaries. Function: regulates metabolism, growth, development, reproduction, and stress responses. Key action: secretes hormones directly into the bloodstream. Lymphatic or immune system, dense and fluid bounce, the guardian of the body, protecting against pathogens and cleaning fluids. Components: lymph nodes, vessels, spleen, thymus, bone marrow, lymphocytes. Function: defends the body against infection, removes toxins, and drains excess interstitial fluid to return it to the blood. Urinary or renal system, waste elimination, filters blood and maintains fluid balance. Components: kidneys, ureters, bladder, urethra. Function: filters waste products from the blood, regulates electrolyte balance, controls blood pressure, and produces urine. Integumentary system, protectant, the body's largest organ system, acting as the first line of defense. Components: skin, hair, nails, sweat glands. Function: protects internal tissues from external injury and dehydration, helps regulate temperature, and has sensory receptors. Reproductive system, procreation, ensures the survival of the species by creating offspring. Components: female, uterus, ovaries, fallopian tubes, vagina. Components: male, testes, penis, prostate gland. Function: produces gametes, egg or sperm, and sex hormones, facilitates fertilization, and supports fetal development. Interdependence of systems. These 11 systems do not work in isolation. For example, during exercise, nervous system increases heart rate, respiratory system increases breathing rate to supply oxygen, cardiovascular system transports the oxygen faster to muscles, muscular system produces heat, and integumentary system produces sweat to cool the body. This seamless coordination is called homeostasis. III, bone structure and classification. Bone are living tissue composed of collagen for flexibility and calcium hydroxyapatite for hardness. Classification by shape. Long bones, longer than they are wide, act as livers, either femur, humerus. Short bones, cube-shaped, provide stability, either carpals. Flat bones, thin and curved, protect organs, either ribs, skull, sternum. Irregular bones, complex shapes, either vertebrae. Sesamoid bones, embedded in tendons, either patella. Structural layers, compact bone, cortical, dense outer shell providing strength. Spongy bone, cancellarious, trabecular, honeycomb-like inner structure filled with marrow. Periosteum, a tough outer membrane covering the bone, essential for repair and nutrition. IV, bone cells and remodeling. Bones are constantly remodeling, breaking down old bone and building new bone. Osteoblasts, build new bone matrix. Osteocytes, mature bone cells that maintain structure. Osteoclasts, break down, reabsorb bone tissue. V, joints, articulations, places where bones meet, allowing for movement and stability. Symarthrosis, immovable joints, either skull sutures. Amphibiarthrosis, slightly movable joints, either vertebrae. Diarthrosis, freely movable joints, either knee, elbow. These often feature synovial fluid lubrication. 6V, clinical significance, disorders. Osteoporosis, decreased bone density leading to brittle bones. Osteogenesis imperfecta, genetic disorder causing extremely brittle bones. Fractures, breaks in bone requiring immobilization for healing. Arthritis, inflammation of joints.
The human skeletal system is a dynamic
Living framework composed of 206 bone in the adult body, along with cartilage, ligaments, and tendons that connect them. It is not merely a rigid structure, but a multifunctional system responsible for protection, movement, mineral storage, and blood cell production. Major functions of the skeletal system. The skeleton performs 6 primary functions essential for survival. Support. It provides the structural framework for the body, maintaining its shape and supporting soft tissues. Protection. Bones protect delicate internal organs. Key examples include the skull, brain, vertebrae, spinal cord, and ribs, heart, and lungs. Movement. Bones act as levers. Muscles attached to bones by tendons pull on them to produce movement. Mineral storage and homeostasis. Bones act as a reservoir for essential minerals, particularly calcium and phosphorus, releasing them into the bloodstream as needed. Blood cell production. Hematopoiesis. Red bone marrow found in the spongy bone of certain bones, like the pelvis and sternum, produces red blood cells, white blood cells, and platelets. Endocrine regulation. Bone cells release a hormone called osteocalcin, which regulates blood sugar, glucose, and fat deposition. Divisions of the skeleton. The skeletal system is divided into 2 major parts. A. Axial skeleton, 80 bones, forms the central axis of the body and focuses on protection and support. Skull includes cranial bones protecting the brain and facial bones. Vertebral column comprised of 24 vertebrae plus the sacrum and coccyx protecting the spinal cord. Cervical 7, neck. Thoracic 12, upper back. Lumbar 5, lower back. Thoracic cage 12 pairs of sternum bone. Hyoid and ossicles. The hyoid bone in the throat and small bone in the ear. B. Appendicular skeleton 126 bones. Comprises the bones of the limbs and girdles, enabling locomotion and interaction with the environment. Pectoral girdle, clavicle, collarbone, and scapula, shoulder blade. Upper limbs, humerus, upper arm, radius ulna, forearm, carpals, wrist, metacarpals, hand, and phalanges, fingers. Pelvic girdle, hip bones, ilium, ischium, pubis. Lower limbs, femur, thigh, strongest bone, patella, kneecap, tibia, fibula, leg, tarsals, ankle, metatarsals, foot, and phalanges, toes. Fractures, breaks in bone requiring immobilization for healing. Arthritis, inflammation of joints.
IV, mechanism of muscle contraction. Slide film theory. Muscle contract when impulses trigger short and muscular. Stimulation. A motor neuron releases a neurotransmitter, acetylcholine, at the neuromuscular junction. Calcium release. The impulse causes the sarcoplasmic reticulum to release calcium ions. Binding. Calcium binds to tropinin, exposing myosin binding sites on actin filaments. Power stroke. Using ATP, myosin heads bind to actin, swivel, and pull the thin actin filaments towards the center of the sarcomere, shortening it. Relaxation. When the signal stops, calcium is pumped back into storage. Myosin releases actin, and the muscle relaxes. V. Major muscle groups. The muscular system is often categorized by body region. Head, neck, masseter, chewing, orbicularis oculi, linking, sternocleidomastoid, neck turning. Trunk, core, background major, chest, the distance dorsai, back, rectus abdominis, abs, diaphragm, breathing. Upper limbs, deltoids, shoulder, biceps brachii, front arm, triceps brachii, back arm, lower limbs, gluteus maximus, hip, quadriceps femoris, thigh, hamstrings, thigh, backstrap medius, calf. V. Muscle function types. Agonists versus antagonists. Skeletal muscles rarely work alone. They operate in teams. Agonist, prime mover. The primary muscle responsible for movement, e.g. biceps in a curl. Antagonist, the muscle that opposes the agonist, stretching to allow movement, e.g. triceps in a curl. Synergist, helps the agonist work efficiently. V. Muscle types. Fibers. Type 1, slow twitch, red in color, high endurance, used for long duration activities like posture. Type 2A, fast twitch, intermediate speed, moderate resistance fatigue. Type 2B, fast twitch, white in color, very fast and powerful, but fatigues quickly, sprinting. V. Common muscle disorders. Muscular dystrophy, genetic diseases causing progressive weakness. Muscle strains, tears in muscle fibers, pulled muscle. Myasthenia gravis, chronic autoimmune disorder impairing neuromuscular junction. Fibromyalgia, chronic pain in muscles and tissues. I. Maintain a healthy muscular system. Real exercise, strength training, isotonic, isometric, improves muscle mass, while low weight exercise increases stamina. Nutrition, adequate protein intake is vital for muscle repair Water is necessary for contraction and preventing cramps. Rest allows muscle fibers to repair after exertion. Recovery.
Pesticides from fruit and vegetables. To remove pesticides from fruit, wash produce under cold running water while spraying with a soft brush, or soak in a baking soda solution. 1 teaspoon per 2 cups of water for 12 to 15 minutes. Peeling, removing outer leaves, and buying organic, e.g. from EWG's Shopper's Guide, also significantly reduce exposure. Most effective cleaning methods. Baking soda soak, most effective. Mix 1 teaspoon of baking soda for every 2 cups or 2 teaspoons per quart of cold water. Soak fruits for 12 to 15 minutes, then rinse thoroughly. Vinegar wash. Mix 1 part white vinegar with 3 parts water, and soak produce for 5 to 15 minutes. This can remove 40 to 90% of pesticide residues, though it may change the taste of delicate berries. Running water and scrubbing. Scrub firmer produce, apples, pears, cucumbers, with a soft brush under cold running water for at least 30 seconds. Salt water wash. A 2% salt solution, 1 teaspoon salt in 1 cup water, and remove most contact pesticides. How to remove pesticides from produce. Berries and soft fruits. Use the baking soda soak briefly and rinse thoroughly, as they can absorb vinegar. Leafy greens. Remove outer leaves, soak in water for a few minutes, and rinse well. Wax fruits, apples, and peaches. Scrub firmly, as pesticides can stick to the wax. Peeling. For items like cucumbers or apples, peeling removes surface pesticides, though it also removes some nutrients. Key considerations. Water only. Simply rinsing under running water removes dirt and some pesticides, but is less effective than soaking with baking soda. Storage. Wash fruit just before eating, not before storing, to prevent mold growth. Limitations. While these methods remove surface residue, they may not eliminate systemic pesticides that have absorbed into the fruit itself.
Human muscular system is a complex, specialized organ system consisting of over 600 main skeletal muscles, along with smooth and cardiac muscles, collectively making up roughly 40-50% of an adult's body weight. Its primary purpose is to produce movement, maintain posture, circulate blood, and generate heat. I1. Types of muscle tissue. The human body contains 3 distinct types of muscle tissue, classified by their structure, function, and control mechanism. Skeletal muscle. Attached to bones by tendons, these muscles are under voluntary control. Somatic nervous system. They appear striped or striated under a microscope due to organized sarcomeres. They enable locomotion, facial expressions, and posture. Smooth visceral muscle. Located in the walls of hollow internal organs, stomach, intestines, blood vessels. They are involuntary, non-striated, and controlled by the autonomic nervous system. They are responsible for processes like peristalsis, moving food, and regulating blood pressure. Cardiac muscle. Found only in the heart, myocardium. It is striated like skeletal muscle, but functions involuntarily. Cardiac cells are branched and connected by intercalated discs, allowing them to catch synchronously to pump blood. I2. Core functions of the muscular system. The muscular system serves several essential roles, far exceeding mere movement. Movement, mobility. Skeletal muscles contract to move bones. Posture and stability. Muscles continuously adjust to hold the body upright or in specific positions. Circulation. The heart pumps blood, while smooth muscles in veins and arteries help regulate blood flow. Respiration. The diaphragm and intercostal muscles contract to allow breathing. Digestion. Smooth muscles move food through the GI tract via peristalsis. Heat production. Thermoregulation. Muscular contraction generates 85% of body heat, particularly via shivering when cold. I3. Anatomy and microstructure of muscles. Muscle fiber. Cell. A single muscle cell bundled together with thousands of others to form muscle. Fascicle. A bundle of muscle fibers wrapped in a sheath called perimysium. Myofibrils. Thread-like structures within muscle fibers containing protein filaments, actin, and myosin. Sarcomere. The fundamental repeating contractile unit of striated muscle located between 2 Z discs. Connective tissue. Epimysium surrounds the entire muscle. Perimysium surrounds the muscles. Endomysium surrounds individual fibers. Tendons. Dense, strong connective tissue that attaches skeletal muscle to bone.
Looking after your pancreas involves maintaining a healthy lifestyle, with AI and digital health tools increasingly acting as aids for early detection and lifestyle management. The pancreas is crucial for digestion and regulating blood sugar, making it health vital for preventing conditions like diabetes and pancreatitis. Here are the best ways to care for your pancreas, informed by medical recommendations and enhanced by technological advancements. 1. Diet and nutrition. Emphasize low-fat foods. Limit fat intake to reduce the workload on your pancreas. Focus on plant-based foods, cruciferous vegetables, broccoli, cauliflower, whole grains, and lean proteins. Avoid high-fat and sugary foods. Minimize processed foods, sugary drinks, and refined carbohydrates, which can increase the risk of pancreatic inflammation, pancreatitis. Small frequent meals. Instead of 3 large meals, eat 4 to 6 small balanced meals to prevent overloading the pancreas. Stay hydrated. Drink plenty of water, around 6 to 8 cups daily, to prevent pancreatic flares and support enzyme production. 2. Lifestyle modifications. Stop smoking. Smoking is a significant risk factor for pancreatic cancer, with smokers being 2 to 3 times more likely to develop it. Limit or avoid alcohol. Heavy alcohol consumption is a primary cause of pancreatitis. Avoiding it entirely is recommended for those with pancreatic issues. Exercise regularly. Aim for 150 minutes of moderate exercise weekly. For example, fast walking, cycling, to maintain a healthy weight and improve insulin sensitivity. Manage stress. Chronic stress releases cortisol and can increase the risk of pancreatitis. Techniques like yoga, meditation, and deep breathing are recommended. 3. Leveraging technology and AI. Early detection and screening. AI algorithms are being developed to detect pancreatic cancer, sometimes up to a year before symptoms appear, by analyzing CT scans for cell signs radiologists might miss. Wearable health tech. Smartwatches and apps can help track physical activity, heart rate, and overall health, and manage weight and stress. AI for recurrence prediction. In cases of pancreatitis, AI can analyze patient data and imaging to predict the likelihood of recurrence and assist in personalized monitoring. Self-monitoring apps. Use apps to monitor dietary intake and ensure a low-fat diet, which is critical for those recovering from acute pancreatitis. 4. Mention to see a doctor. If you experience symptoms like persistent upper abdominal pain, unexplained weight loss, or yellowing skin, jaundice, seek medical advice, as these can be early signs of pancreatic issues. Disclaimer. This information is for educational purposes based on current research results and should not replace professional medical advice. Always consult a healthcare provider for any health concerns. Vitamin K and warfarin interact directly, as vitamin K promotes blood clotting, while warfarin, a blood thinner, works by inhibiting it. To maintain a safe international normalized ratio, INR, patients must keep their daily vitamin K intake consistent, rather than avoiding it entirely. A sudden increase in vitamin K lowers INR, increases clot risk, while a decrease raises INR, increases bleeding risk. The mechanism: vitamin K versus warfarin. Vitamin K function is essential for the activation of clotting factors 2, 7, 9, 10 in the liver, which allows blood to clot. Warfarin function acts as a vitamin K antagonist, VKA. It inhibits the enzyme VKORC1, preventing the regeneration of active vitamin K and reducing blood clotting ability. Interaction: large amounts of vitamin K can overcome the inhibition caused by warfarin, making medication less effective. Managing vitamin K intake. Dietary advice. The goal is consistency, not elimination. A steady, stable intake of vitamin K enables a stable INR. High vitamin K foods. Keep consistent. Kale, spinach, collard greens, turnip greens, Brussels sprouts, broccoli, and Swiss chard. Low vitamin K foods. Stay to eat regularly. Roots, bulbs, tubers, potatoes, carrots, many fruits, bananas, cucumbers, and white mushrooms. Consistency is key. Keep a salad every day. Continue to use. Do not suddenly stop or start eating large amounts of green vegetables. Monitoring your INR. INR, international normalized ratio, a laboratory test that measures how long it takes your blood to clot. Target range: generally 2.0 to 3.0 for most conditions, e.g. atrial fibrillation. Low INR, risk of clotting, usually caused by high vitamin K intake, making the drug less effective. High INR, risk of bleeding, usually caused by low vitamin K intake, making the drug too effective. Key tips for patients: consult a doctor before diet changes. Any major change in diet, e.g. keto, vegan, or weight loss, requires close monitoring. Multivitamins: check if your multivitamin contains vitamin K. If you take one, take daily to maintain consistency. Inform all providers. Ensure every doctor knows your warfarin before they prescribe new medications or suggest diet changes. Disclaimer: this information is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider for management of diet.
A healthy digestive system
Is foundational to overall well-being. It promotes immunity, energy levels, and mood. Achieve optimal gut health requires a holistic approach to high fiber, nutrient diet, consistent hydration, stress management, and regular movement. 1. Diet and nutrition good health. Prioritize fiber. Consume 25 to 35 grams of fiber daily to aid digestion, prevent constipation, and feed beneficial bacteria. Soluble fiber. Dissolves in water, helping to lower cholesterol and glucose levels. Sources include oats, barley, beans, apples, and citrus fruits. Insoluble fiber. Adds bulk to stool, helping move food through the digestive tract. Sources include whole grains, wheat bran, and vegetables. Increase plant diversity. Aim for 30 different plant-based foods per week to maximize microbial diversity. Include probiotics, good bacteria. Eat fermented foods daily to introduce beneficial bacteria that fight bad bacteria. Examples include yogurt, light cultures, kefir, sauerkraut, kimchi, miso, and kombucha. Consume prebiotic foods, food for bacteria. Prebiotics are indigestible fibers that act as fuel for probiotics. Examples include garlic, onions, leeks, carrots, bananas, add healthy fats. Incorporate omega-3 fatty acids to reduce inflammation. Examples include fatty fish, salmon, sardines, chia seeds, flax seeds, and walnuts. Reduce your risk. Limit intake of processed foods, artificial sweeteners, refined sugars, and purified foods. 2. Lifestyle habits to support digestion. Stay hydrated. Drink plenty of fluids. Water test to allow nutrients to be absorbed and prevent constipation. Tip: sip water between meals and consider warm water in the morning to stimulate bowels. Practice mindful eating. Chew food thoroughly and eat slowly to reduce overload in the stomach. Manage stress. The gut brain axis means high stress, low digestion, and increased inflammation. Practice yoga, deep breathing, or meditation. Regular exercise. Exercise increases blood flow to the digestive tract and stimulates intestinal contractions. Prioritize sleep. Aim for 7 to 9 hours of quality sleep to lead to gut repair. Avoid smoking and alcohol. Smoking causes risk acid reflux, while alcohol increases stomach acid and starts the gut microbiome. 3. Keep foods 2 food versus avoid. Food to focus on, gut friendly. Foods to limit, digestions, fiber/carbs, whole grains, oats, brown rice, quinoa, white bread, white pasta, pastries, vegetables, leafy greens, spinach, kale, broccoli, carrots, raw onions, garlic, extensive. Fruits, berries, citrus fruits, bananas, low fructose, high fructose, extensive. Protein, lean protein, fish, poultry, legumes, tofu, red meat, processed meats, sausage, bacon, drinks, water, proteins, ginger, peppermint, alcohol, carbonated drinks, excessive coffee. 4. Once you see a doctor, you need more persistent digestive issues, like anemia and conditions like irritable bowel syndrome, gastro-esophageal reflux disease, or limb paralysis. Seek professional guidance for limit severe digestive health, with center digestive health, persistent bloating, fast heartburn, frequent long lasting constipation, diarrhea, unexplained weight loss, low blood and stool, chronic abdominal pain.
These sentences foundations overall well-being, low immunity, energy levels, and mood. Achieving optimal gut health requires a holistic approach, combining a high-fiber, nutrient diet, consistent hydration, stress management, regular movement. 1. Diet and nutrition for gut health. Prioritize fiber. Consume 25 to 35 grams of fiber daily to aid digestion, prevent constipation, and feed vegetable bacteria. Soluble fiber. Dissolves in water, helping to lower cholesterol and glucose levels. Sources include oats, barley, beans, apples, and citrus fruits. Insoluble fiber. Adds bulk to stool, helping move food through the digestive tract. Sources include whole grains, wheat bran, and vegetables. Increase plant diversity. Aim for 30 different plant-based foods per week and maximize microbial diversity in the gut. Include probiotics, good bacteria. Eat fermented foods daily to introduce beneficial bacteria that fight bad bacteria. Examples include yogurt, cultures, kefir, sauerkraut, kimchi, miso, and kombucha. Consume prebiotic foods, food good bacteria. Prebiotics are indigestible fibers that active store probiotics. Examples include garlic, onion, leeks, asparagus, bananas, and oats. Add healthy fats. Incorporate omega-3 acids to reduce fat inflammation. Examples include fatty fish, salmon, sardines, chia seeds, flax seeds, and walnuts. Reduce appearance. Limit intake of processed foods, artificial sweeteners, brown sugars, increase fried foods. 2. Lifestyle habits to support digestion. Stay hydrated. Drink clean fluids, water fast, rely on nutrients to absorb and prevent constipation. Tip. Sip water between meals and consider warm wine when visiting meals. Practice mindful eating. Chew food thoroughly and eat slowly to reduce overload and manage stress. The gut brain axis means high stress, low digestion, and increased inflammation. Practice yoga, deep breathing, meditation. Regular exercise. Exercise increases blood flow to the digestive tract and stimulates intestinal contractions. Prioritize sleep. Aim for 7 to 9 hours quality sleep and eat to allow gut to repair. Avoid smoking and alcohol. Smoking doubles risk acid reflux, while alcohol increases stress and disrupts gut microbiome. 3. Key foods to include versus avoid. Food to focus on, gut friendly. Foods to limit, gut vitamins, fibers, carbs, whole grains, oats, brown rice, quinoa, white bread, white pasta, pastries, vegetables, leafy greens, spinach, kale, broccoli, carrots, raw onions, garlic, sensitive, fruits, berries, citrus fruits, bananas, low fructose, high fructose, sensitive, protein, lean protein, fish, poultry, legumes, tofu, raw meat, processed meats, sausage, bacon, drinks, water, herbal teas, ginger, peppermint, alcohol, carbonated drinks, excess coffee. 4. Medicine doctor. Do not ignore persistent digestive issues, as they may indicate conditions like irritable bowel syndrome, gastric esophageal reflux disease, or inflammatory bowel disease. See question 94. Mr. Health. Mr. Health. Persistent bloating, gas, or heartburn, frequent long-lasting constipation, diarrhea, isolated hospital and stool, chronic abdominal pain. Note: if you have specific cases of health condition, it is also testing health provider or the patients with kidney stones. How to look after your kidneys. To take care of your kidneys, maintain a healthy lifestyle, staying hydrated, exercising regularly, limiting salt intake, managing blood pressure and blood sugar, and avoiding smoking and unnecessary NSAID pain medications. Key practices also include eating a balanced diet, limiting alcohol, and getting regular kidney function screenings. Key tips for kidney health. Stay hydrated. Drink enough water consistently to help kidneys remove waste, but avoid excessive water intake. Focusing on being water-wise. Manage blood sugar and pressure. High blood sugar, diabetes, and high blood pressure are the leading causes of kidney disease. Reduce salt intake. Consume less than 2,300 milligrams of sodium daily to help control blood pressure. Eat a healthy diet. Focus on whole grains, fruits, vegetables, and lean proteins, and avoid processed foods that are often high in sodium and phosphorus. Exercise and weight control. Maintain a healthy weight to prevent diabetes and heart disease, which can lead to kidney issues. Limit medications. Avoid overusing common over-the-counter anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, which can cause kidney damage if taken regularly. Quit smoking. Smoking reduces blood flow to kidneys, which can impair their ability to function. Synonyms and related terms: kidney health preservation, renal care, renal protection, kidney maintenance, kidney wellness. When to seek care. Kidney disease often has no early symptoms. It is essential to get tested for kidney function, blood, and urine tests if you have high blood pressure or diabetes.
There are 13 essential vitamins and numerous vitamin minerals required for human health, generally categorized into fat-soluble vitamins A, D, E, K, water-soluble vitamins C and the 8 B vitamins, and minerals, macro and trace elements. These nutrients, essential for functions like immune support, bone health, and energy metabolism, must be obtained through a balanced diet or supplements. Essential vitamins: vitamin A, retinol, beta-carotene, essential for vision, skin health, and immune function. Vitamin C, ascorbic acid, antioxidant, essential for collagen production, wound healing, and immune system strength. Vitamin D, cholecalciferol, vital for calcium absorption, bone health, and immune function, produced via sunlight exposure. Vitamin E, tocopherol, antioxidant that protects cells from free radical damage. Vitamin K, phytoquinone, menaquinone, essential for blood clotting and bone health. Vitamin B1, thiamine, metabolizes food into energy and supports nerve flow. Vitamin B2, riboflavin, necessary for energy production and cellular metabolism. Vitamin B3, niacin, supports nervous system, heart health, and energy metabolism. Vitamin B5, pantothenic acid, crucial for fatty acid synthesis and energy metabolism. Vitamin B6, pyridoxine, crucial for protein metabolism, red blood cell formation, and cognitive function. Vitamin B7, biotin, essential for energy metabolism and healthy hair and nails. Vitamin B9, folate, folic acid, crucial for DNA synthesis and cell replication. Vitamin B12, cobalamin, necessary for red blood cell formation and neurological function. Key minerals: calcium, major component of bones and teeth, required for muscle contraction and blood clotting. Iron, component of hemoglobin that transports oxygen in the blood. Magnesium, involved in over 300 metabolic reactions, including heart and nerve function. Potassium, regulates blood pressure, fluid balance, and muscle contractions. Sodium, essential for nerve function and fluid balance. Zinc, supports immune function, wound healing, and DNA synthesis. Iodine, essential for thyroid function and metabolic regulation. Chromium, assists with blood sugar regulation. Manganese, supports bone health and metabolism. Phosphorus, involved in energy production and bone structure. There are 13 essential vitamins needed for healthy bodily function, classified into two main groups: fat-soluble, A, D, E, K, which are stored in the body, and water-soluble, C and all B vitamins, which are not stored and require regular consumption. These nutrients are vital for metabolism, immune function, and nutrient absorption. Fat-soluble vitamins, stored in liver and fat tissue. Vitamin A, crucial for vision, immune system health, and skin health. Vitamin D, promotes calcium absorption for bone health and immune function, known as the sunshine vitamin. It includes D2 and D3 types. Vitamin E acts as an antioxidant, protecting cells from damage. Vitamin K, essential for blood clotting and bone health. Water-soluble vitamins, not stored, need daily intake. Vitamin C, ascorbic acid, acts as an antioxidant, supports immune function, and promotes collagen synthesis. B vitamins, complex, crucial for energy production and metabolism. B1, thiamine, helps convert nutrients into energy. B2, riboflavin, essential for energy production and cell function. B3, niacin, supports energy metabolism. B5, pantothenic acid, involved in fatty acid synthesis. B6, pyridoxine, vital for amino acid metabolism and red blood cell production. B7, biotin, involved in metabolism of proteins and carbohydrates. B9, folate or folic acid, crucial for DNA synthesis and cell division. B12, cyanocobalamin, crucial for nervous system function and red blood cell formation. Key differences: storage: fat-soluble vitamins are stored in the liver and fatty tissues. Water-soluble vitamins are generally not stored, and excess is excreted via urine, with the exception of B12. Toxicity: fat-soluble vitamins can reach toxic levels if consumed in excessive amounts, while water-soluble vitamins are less likely to be toxic. Common food sources: fat-soluble, leafy green vegetables, vegetable oils, nuts, eggs, fatty fish, and fortified dairy. Water-soluble: citrus fruits, broccoli, potatoes, fortified grains, dairy, meat, and legumes. Vitamin K is a group of fat-soluble vitamins essential for blood clotting, coagulation, bone metabolism, and regulating calcium levels in the body. It acts as a necessary cofactor for enzymes that activate specific proteins, known as GLA proteins, which enable calcium binding. Key forms of vitamin K. Vitamin K1, phytoquinone, primarily found in green leafy vegetables, plant-sourced. It is the main dietary form, comprising 75 to 90% of total vitamin K intake. Vitamin K2, menaquinone, synthesized by bacteria, primarily found in fermented products, animal-based foods, and gut flora. It includes subtypes like MK4 and MK7, with MK7 offering superior bioactivity and longer half-life in the body. Vitamin K3, menadione, a synthetic form, is generally not used for human consumption due to potential toxicity. Primary physiological functions: blood coagulation, clotting. Vitamin K is necessary for the liver to produce 4 essential blood clotting factors: II, prothrombin, 7, 9, and 10. Bone health: it activates osteocalcin, a protein that binds calcium to the bone matrix, supporting bone mineralization and strength. Vascular health: calcification inhibition. Vitamin K activates matrix cell protein, MGD, which prevents osteocalcification, inhibiting the hardening of blood vessels and reducing cardiovascular risk. Food sources: leafy greens, kale, spinach, broccoli, Brussels sprouts, cabbage, lettuce, chard, mint foods, natto, high K2 content, cheese, animal products, meat, dairy, and egg yolks, vegetable oils, soybean, canola, and olive oil. Daily recommendations: adequate intake, AI. The recommended daily intake of vitamin K, mainly based on vitamin K1, is adult men 19 plus 120 micrograms per day, adult women 18 plus 90 micrograms per day. Newborns: prophylactic injection of 0.5 micrograms of K1 is routinely given to prevent vitamin K deficiency bleeding, VKD. Deficiency and symptoms: vitamin K deficiency is rare in healthy adults, but can occur due to malabsorption disorders, e.g. cystic fibrosis, celiac disease, or long-term antibiotic use. Symptoms: easy bruising, excessive bleeding, hemorrhaging, bleeding gums, and nosebleeds. Consequences: increased risk of osteoporosis, fractures, and cardiovascular disease. Drug interactions: warfarin, codeine. Vitamin K antagonists warfarin are used for medical cause. People on warfarin must maintain a consistent stable intake of vitamin K, as some changes in considerably alter drug effectiveness. Antibiotics: long-term use to kill intestinal bacteria that produce vitamin K2, orlistat, weight loss, and reduce the absorption of fat-soluble vitamins, including K. Toxicity: there is no established tolerable or predicted level well for vitamin K, as there is no potential for toxicity from food or supplements. The high dose can affect blood medications. Vitamin D is a unique fat-soluble nutrient that acts more like a steroid hormone than a nutritional vitamin. It is essential for maintaining calcium and phosphate levels to keep bones, teeth, and muscles healthy. Sources of vitamin D. Your body can obtain vitamin D through 3 primary avenues. Sunlight, often called the sunshine vitamin. Your skin synthesizes vitamin D3, cholecalciferol, when exposed to ultraviolet B, UVB radiation.
Natural food sources are limited, but include fatty fish, salmon, mackerel, fish liver oils, and egg yolks. Some foods like milk and cereals are often fortified with it. Supplements available as vitamin D2 or goat cholesterol from plants, or vitamin D3 cholesterol, typically from animal sources, with D3 generally being more effective at raising blood levels. Biological activation process. Vitamin D from summer food is inert and must go through a two-step activation process in the body. Liver. It is converted into 25-hydroxyvitamin D, 25-OHD, also known as calcium. This is the form doctors measure in blood tests to check your status. Kidneys. It is further converted into 1,5-dihydroxyvitamin D, 1,5-OH2D, or calcitriol, which is a physiologically active hormonal form. Key functions and benefits. Active vitamin D binds to receptors found in nearly every tissue in the body, influencing over 1,000 to 2,000 genes. Bone health. It stimulates the absorption of calcium and phosphorus from the gut, preventing conditions like grades in children and osteomalacia, bone pain, or osteoporosis in adults. Immune support. It acts as an immune modulator, enhancing innate immunity while regulating adaptive responses to prevent overactivity. Cell growth. It helps regulate cell differentiation and proliferation, with their role in reducing the risk of certain cancers. Mood and metabolism. Research tests links to mood regulation, insulin secretion, and cardiovascular health. Deficiency and recommendations. Low levels are often caused by limited sun exposure, certain medical conditions like COPD or kidney disease, or obesity. Optimal levels. Most health organizations consider levels above 30 milligrams per ml as optimal. Daily intake. The National Institute of Health (NIH) recommends an adequate intake of 400 IU for infants and recommended dietary allowance (RDA) of 600 to 800 IU for most adults. National Institute of Health AI machine learning and vitamin D research. Modern AI is now used to predict efficiency. Machine learning algorithms like XGBoost or random forest analyze lifestyle, demographic, and clinical factors to identify individuals at high risk of deficiency without needing data tests. Analyze health trends. AI models process massive tests for trials like vital to better understand how vitamin D levels correlate with chronic diseases. Would you like specific dosage recommendations based on your age or more info on how to optimize absorption? Vitamin C, bioacid acid, is an essential water-soluble micronutrient and potent antioxidant crucial for immune function, collagen synthesis, and iron absorption. Adults generally require 100 to 200 milligrams per day to maintain health, with higher needs during pregnancy. It prevents scurvy and supports tissue repair, skin health, and protects cells from oxidative damage. Key aspects of vitamin C. Essential function. Because humans can't produce vitamin C internally, it must be consumed daily through diet, as it is not stored in the body. Immune support. It acts as an immune hero by stimulating antibody production, specifically natural killer cells, which enhances the body's defense against pathogens. Collagen and tissue repair. Crucial for producing collagen, making it vital for skin health, wound healing, and maintaining blood vessel integrity. Antioxidant power. Protects cells from free radical damage, which can help lower the risk of chronic disease. Iron absorption. Enhances the absorption of non-heme iron from plant-based foods, which is essential for preventing iron deficiency anemia. Dietary sources. Vitamin C is found in many fruits and vegetables, particularly fruits, citrus fruits, oranges, lemons, kiwi, strawberries, and papaya. Vegetables, red peppers, broccoli, Brussels sprouts, kale, and sweet potatoes. Deficiency and toxicity. Deficiency. Lack of vitamin C leads to scurvy, characterized by bleeding gums, easy bruising, rough skin, hair loss, joint pain, and slow wound healing. Toxicity. While excess vitamin C is excreted, high doses, generally 1,000 milligrams per day, can cause digestive distress, such as nausea and diarrhea. Common misconceptions. Colds. While vitamin C helps support the immune system, it does not necessarily prevent common cold, but it may reduce the severity or duration of symptoms. Skincare. Topical vitamin C is widely recommended for breaking and anti-aging properties, often utilized to reduce dark spots and protect against UV damage. Dosage recommendations. Adults. The recommended dietary levels are for adults is around 90 milligrams for men and 75 milligrams for women per day. Optimal health. Many experts suggest daily intake of 200 to 500 milligrams for optimal antioxidant benefits. Disclaimer. This information is for educational purposes only. Always consult a healthcare professional before starting high-dose supplements, particularly if not underlying health conditions or routine medications like chemotherapy. Essential vegan-friendly B vitamins, B1, B3, B5, B7, B9, B12 are obtained through whole foods and fortified products. Key sources include nutritional yeast, fortified cereals, milks, legumes, lentils, chickpeas, nut seeds, sunflower almonds, whole grains, quinoa, brown rice, leafy greens, and avocados. Vegan B vitamin sources. B1, thiamine, nutritional yeast, yeast extract, sunflower seeds, tahini, whole grains. B2, riboflavin, nutritional yeast, almonds, quinoa, mushrooms, fortified cereals. B3, niacin, nutritional yeast, peanuts, brown rice, whole wheat spaghetti, avocado. B5, pantothenic acid, mushrooms, avocado, potatoes, broccoli, whole grains. B6, pyridoxine, chickpeas, potatoes, bananas, nutritional yeast, walnuts. B7, biotin, nuts, almonds, walnuts, sunflower seeds, sweet potatoes, broccoli. B9, folic acid, dark leafy greens, spinach, lentils, oranges, asparagus, beets. B12, cobalamin, crucial for vegans to use fortified foods, fortified nutritional yeast, fortified plant milks, soya, coconut, fortified breakfast cereals, and tempeh. Key takeaways. Nutritional yeast is a versatile powerhouse, often providing B1, B3, and B12. Fortified foods are the most reliable source of B12, which is otherwise scarce in the vegan diet. Legumes and nuts provide a steady supply of B1, B3, B7, and B9. If you'd like to dive deeper, I can help you identify specific, easy meal plans to hit all 8 B vitamins, suggest the best supplement options for B12, just in case. Compare fortified foods to see which ones offer the most bang for your buck. Let me know if you'd like me to narrow down the best, most nutrient-dense options for your routine. B vitamins, benefits, and best vegan sources. Food Revolution Network, August 26, 2021. More specifically, below are some of the best places to find each of the 8 B-complex vitamins for plant-based foods. Vitamin B1, beans, peas, lentils, and stuff. Essential vegan-friendly vitamins, B1, B3, B5, B7, B9, B12 are obtained through whole foods and fortified products. Key sources include nutritional yeast, fortified cereals, milks, legumes, lentils, chickpeas, nut seeds, sunflower almonds, whole grains, quinoa, brown rice, leafy greens, and avocados. Vegan B vitamin sources. B1, thiamine, nutritional yeast, yeast extract, sunflower seeds, tahini, whole grains. B2, riboflavin, nutritional yeast, almonds, quinoa, mushrooms, fortified cereals. B3, niacin, nutritional yeast, peanuts, brown rice, whole wheat spaghetti, avocado. B5, pantothenic acid, mushrooms, avocado, potatoes, broccoli, whole grains. B6, pyridoxine, chickpeas, potatoes, bananas, nutritional yeast, walnuts. B7, biotin, nuts, almonds, walnuts, sunflower seeds, sweet potatoes, broccoli. B9, folic acid, dark leafy greens, spinach, lentils, oranges, asparagus, beets. B12, cobalamin, crucial for vegans to use fortified foods, fortified nutritional yeast, fortified plant milks, soya, coconut, fortified breakfast cereals, and tempeh. Key takeaways. Nutritional yeast is a versatile powerhouse, often providing B1, B3, and B12. Fortified foods are the most reliable source of B12, which is otherwise scarce in the vegan diet. Legumes and nuts provide a steady supply of B1, B3, B7, and B9. If you'd like to dive deeper, I can help you identify specific, easy meal plans to hit all 8 B vitamins, suggest the best supplement options for B12, just in case. Compare fortified foods to see which ones offer the most bang for your buck. Let me know if you'd like me to narrow down the best, most nutrient-dense options for your routine. B vitamins, benefits, and best vegan sources. Food Revolution Network, August 26, 2021. More specifically, below are some of the best places to find each of the 8 B-complex vitamins for plant-based foods. Vitamin B1, beans, peas, lentils, and stuff.
मुसलसल पायदार आदात को अपनाकर एक तवील सेहतमंद जिंदगी बेहतरीन तरीके से की जा सकती है। नाम से भरपूर गज़ा खाना, बाकायदगी से वर्जिश करना, 150 मिनट से ज़्यादा हफ्ता, सेहतमंद वज़न बरकरार रखना, सिगरेट नोशी से इज्तिनाब, शराब से परहेज़, 7 घंटे की नींद लेना और मजबूत समाजी दबाव की आइन करना और इसकी परवरिश करना। ये आदत मुमकिन तौर पर मतबा उम्र में 1 दहाई से ज़्यादा इजाफा कर सकती है। लंबी उम्र के लिए करीबी उसूल, ग़िज़ाई आदत, सब्जियां, फल, बगैर छना अनाज, गीला नीली और सेहतमंद चिकनाई जैसे बाकी की खुराक, बॉडी का इस्तेमाल करें, जबकि प्रोसेस्ड फूड्स, सुर्ख गोश्त और मीठे मशरूबात को कम से कम करें। जिस्मानी सरगर्मी, फी हफ्ता कम से कम 150 मिनट की ईद वज़न या 65 मिनट की भरपूर वर्जिश मशरूम रहे। मशरूम बच्चों की बड़े पैमाने पर सेहत और मजबूती को बरकरार रखने के लिए वज़न बढ़ाने की तरबियत। तंबाकू नोशी से परहेज़ करें। तंबाकू नोशी करना बहुत ज़रूरी है क्योंकि इससे परहेज़ कैंसर और कब्ज़ खतरा को कम करता है। नींद खराबी, याददाश्त, जज़्बाती ज़ब्ती और इम्यून सेहत की मदद के लिए रात को 7 से 8 घंटे की मेयादी नींद की नींद आए। सामाजिक आदत, लंबी उम्र को बेहतर बनाने के लिए मजबूत मज़हब, ताल्लुकात और सामाजिक जज़्बाती या फ़िक्री मशरूबियत को बरकरार रखें। वज़न का इंतज़ाम, दायमी बीमारियों से बचने के लिए एक सेहतमंद बॉडी मास इंडेक्स यानी BMI आमतौर पर 18/5 और 24/9 रखें। शराब नोशी से परहेज़ करें। अल्कोहल के इस्तेमाल से परहेज़ करें। सेहत की जांच, मुमकिन सिर्फ साइकिल जब तक की डॉक्टर साथ बात करेगा। परहेज़ करने जारी, न्यून वज़न, बड़ी वज़न, गैर फायदा, तनाव के साथ वज़न बढ़ने का ज्यादा खाना, पेट से बाहर खाना, अल्ट्रा प्रोसेस्ड फूड्स, ज़्यादा चीनी और गैस से भरपूर खाना खाने से परहेज़ करना जरूरी है।
A long, healthy life is best achieved by adopting consistent, sustainable habits, eating a plant-rich diet, exercising regularly, 150 plus minutes per week, maintaining a healthy weight, avoiding smoking, avoiding alcohol, getting 7+ hours of sleep, and nurturing strong social connections. These habits can potentially add over a decade to life expectancy. Key rules for longevity. Dietary habits. Consume a diet high in vegetables, fruits, whole grains, nuts, and healthy fats, like the Mediterranean diet, while minimizing processed foods, red meats, and sugary beverages. Physical activity. Engage in at least 150 minutes of moderate or 75 minutes of vigorous exercise per week, including strength training to maintain muscle mass. Avoid smoking. Smoking cessation is crucial, as avoiding it reduces risks of cancer and cardiovascular disease. Prioritize sleep. Ensure 7 to 8 hours of quality sleep nightly to aid in memory, emotional regulation, and cognitive health. Social connection. Maintain strong, positive relationships and social, emotional, or intellectual engagement to improve longevity. Weight management. Keep a healthy body mass index, generally between 18.5 and 24.9, to avoid chronic diseases. Limit alcohol. Consume alcohol in moderation, typically defined as up to 1 drink daily for women and 2 for men. Health screenings. Regular checkups with a doctor for early detection of potential health issues. Habits to avoid. Sedentary lifestyle. Prolonged inactivity. Chronic stress. Failing to manage stress levels. Overeating. Eating beyond satiety. Ultra-processed foods. Foods with high sugar and unhealthy fat content.